When bile ducts are blocked, jaundice, itching, and infection can follow. Here is how doctors relieve that pressure. Bile is a fluid the liver makes to digest fats. It travels through tiny ducts into the intestine. When a duct is blocked, bile backs up into the liver. Skin and eyes turn yellow, urine darkens, itching starts. PTBD stands for percutaneous transhepatic biliary drainage. An interventional radiologist opens the blockage through the skin using imaging. Doctors commonly choose PTBD for bile duct cancers, pancreatic tumors, stones stuck high up, benign scars, bile leaks, or severe infection. Endoscopy, called ERCP, is usually tried first. PTBD is often chosen when ERCP fails or the anatomy makes it impossible. You lie on your back with sedation and local anesthetic. Using ultrasound and X-ray, a fine needle reaches a bile duct in the liver. A thin wire and catheter follow the needle. If the blockage can be crossed, a tube guides bile all the way into the intestine. Sometimes a small mesh or plastic stent is placed inside the duct to hold it open, so no external tube is needed. Most patients stay in hospital for a night or two. Itching often improves within a day. Yellow color fades over weeks. If you go home with a drain, nurses teach you to empty it, flush it, and care for the skin. It becomes routine within weeks. Risks include bleeding, infection, bile leak, or the drain slipping. Fever, new pain, or returning jaundice should be reported quickly. PTBD does not treat the underlying cause. Surgery, chemotherapy, or stone removal may still follow, made safer by the drainage. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.